From A-listers to weekend warriors, can shining red light on your body actually heal you? Or is it just a very expensive nightlight?
You may have seen celebrities wearing face masks before events to keep them looking young. Chrissy Teigen looked like an extra in the latest Tron movie. Victoria Beckham showed her red light home device. And even Jennifer Aniston is attributing some of her eternally youthful looks to red light therapy. Red light therapy has also been touted as a cure for arthritis, sports injuries, and hair loss. In this episode, we're going to dive into the latest science and data around red light therapy to figure out if you should fork out the big bucks for an LED mask or just step out on your porch for a few minutes.
Welcome to Doctors Rating Trends. This is a program where twin Ivy League trained doctors discuss the latest health trends of today. Jess will take the positive and I'll take the negative outlook. And as always, we'll have a discussion in the end to tell you what we think about it.
Let's get into it. So let's talk about how red light therapy is supposed to work. If you're a big fan of things that supposedly light up your mitochondria, this is the one for you. Red light therapy is a low-leveled near-infrared light spectrum. So that means between 600 to 1,000 nanometers of wavelength for those who are keeping track. And this nudges cells, especially the mitochondria in the cells, into higher energy output and also claims to have anti-inflammatory effects. Just for a quick review, mitochondria is a part of the body that generates energy by generating something called ATP or adenosine triphosphate. It does this by activating the electron transport chain. If you remember our methylene blue episode, the methylene blue transported electrons around damaged parts of the electron transport chain directly to an enzyme called cytochrome C. Red light therapy has a similar mechanism of action by activating cytochrome C directly, which ramps up energy production and increases your output of ATP. The other positive effects of red light is that it modulates inflammatory reactive oxygen species and will also upregulate nitric oxide, which can help with inflammation and increasing blood flow. In the skin, it's also thought to increase fibroblast activity through this mitochondrial mechanism, which leads to improved collagen and elastin, which might make your skin look younger. When discussing the therapeutic potential of red light, there's an argument that it goes deeper than other forms of light. This is true, but it only goes a few millimeters deeper, which is barely past the skin. That could have some implications when you're trying to talk about indications that need deep penetration, like joints. Also, it's important to point out that there's no single universally accepted protocol for red light therapy yet. It's still all over the map. Finally, when looking at red light therapy, you have to consider the cost. A lot of the indications say that it needs to be applied to the skin for 15 to 25 minutes, 3 to 4 times a week. Now, this can add up because it can cost anywhere from $25 to $200. And again, that's 3 sessions a week over a period of time. Also, if you want a home device, it could cost upwards of $500. Red light therapy is being used as a treatment for aging skin. Subtle but noticeable improvements in the fine textures and lines can be seen with consistent use, and multiple at-home devices have been FDA cleared for aging. There's a number of studies backing this up that actually subjectively say that people feel younger, they look younger, and there's fewer wrinkles after using it.
It is important to point out that FDA approval is only an endorsement of its safety, but not its effectiveness. Studies related to skin seem to be mostly subjective endpoints of how the skin looks, and there is strong variance in the study design and results. It's hard to make scientific claims with this.
A common use for red light therapy is for sports performance and recovery. A large number of studies report less muscle soreness, faster strength recovery, and some performance gains when timed pre or post-exercise. This modality is used widely by trainers, and it seems, according to the studies, that dosing is better when it's used locally rather than whole body beds.
Most of the studies cited were small and reported in junk journals. The large review studies then pooled the data from these smaller studies to make the claims that they did. I did find one well-done study that tried to reproduce the claims, which showed no benefit. Going back to the basic science, red light therapy penetrates only a few millimeters below the skin, so it's unclear how this is supposed to help deeper structures like muscles and tendons.
Red light therapy is being used for joint pain and recovery, specifically in arthritis. Several randomized controlled trials and meta-analysis for knee osteoarthritis showed reduced pain and improved function versus placebo. Some physical therapy clinics use red light therapy and as an adjunct therapy to their other treatments.
There was no consistency in how the red light was being applied across the studies. Some of the studies showed a positive effect, but they were small and could only be found in junk journals. Given the red light only goes a couple of millimeters below the skin, it is unclear how this is supposed to have a deep impact on structures like joints.
Red light therapy has shown some promising results for hair thinning. Randomized controlled trials show modest density and thickness gains after numerous treatments. The best efficacy was shown as an adjunct to traditional methods like minoxidil, and it's best for early thinning as opposed to when you've already lost your hair.
It's an expensive treatment that needs to happen repeatedly. It isn't a good long-term cure for hair thinning because when you stop the treatment, you go back to where you were before.
Another established use for red light therapy with good science behind it is for the treatment of a condition called oral mucositis, which is a condition that happens in cancer patients that are on a chemotherapy. So let's talk red light therapy. We're seeing real-world users swear by better skin glow, knee pain relief, less post-workout soreness. And there's actually a few trials out there that back up some of that. But the effects, even in the best cases, are modest and require consistent use of a pretty expensive treatment. That said, the mechanism does make sense. And we know how this increases ATP and reduces reactive oxygen species. There are clinical studies showing that it is in fact possible. I mean, with the age-related macular degeneration, hard endpoints of hair growth. So we know that there's something there, and we know that it does work on some level. The question is how much, and if that's really transferable over to other indications like sports and osteoarthritis.
The biggest lifts with the current literature related to sports and arthritis and some of the other things that are really hitting the medical trends right now are all in its subjective endpoints. So pain, how the skin looks, soreness, and then protocols are all over the maps with the studies. So applying it outside of those few indications that we see in the medical world, we're not really seeing good data yet on that. One of the other really interesting things about this is that there is a massive placebo effect. So even when they're doing the studies and they're doing the sham treatments, which are using the same devices with just different wavelengths, they're getting good results out of that. So the placebo effect is very real with this, which confounds a lot of the literature. My biggest question with red light therapy is this mechanism of action, where it is only going a few millimeters below the skin. How is it treating these deeper structures that are quite a ways below the skin, like muscles and tendons? You have to go through a lot of structures to get into the joint space. So it doesn't make sense that you're getting treatment down into these deep tissues, even though the claims are being made otherwise. Another big issue with this is that it's a really expensive treatment. You're looking at $25 to $200 per session, 3 to 5 times a week. Sometimes these treatments are going on for several weeks. There's obviously a motivation to treat people, but the question is, are these really worth it? So generally, when you're seeing a combination of expensive procedures and shaky evidence, I tell patients to run the other way as fast as they can.
If you take a look at this therapy versus unobstructed sunlight for 5 to 20 minutes, it gives about the same amount of red light as the therapeutic dose, which kind of leads you to two thoughts. One, if you believe in the curative power of light, but don't want to spend the money, just go outside. And number two is that there's more sun to sunlight than just giving you vitamin D. This really does elucidate a mechanism of action that does, potentially really help with energy, probably helps with the energy related issues like mental health and, fatigue. So anything that'll light up your cytochrome C, like sunlight or clean blue, or anything that really gets that electron transport chain going is probably worth doing. So this is just another reminder to go outside.
Unless you're a vampire or an albino, there's no reason to not go outside. One of the other claims that's being made is that UV damage from being outside will negate the positive effects. And so if you isolate the red light, that's a good thing. I don't really buy that at all. That certainly isn't supported by science. Red light therapy falls into the category of, but it can't hurt medicine. billions of dollars are spent with that empty trope as the primary reason that people engage in the treatments. Our goal here at Doctors Rating Trends is to keep you from wasting your time and money on these shams.
So let's talk a little bit about the pros and cons of red light therapy. There's objective uses of red light therapy that merit consideration, like for treating age-related macular degeneration and oral mucositis. And it seems to have positive impacts on hair growth and wrinkles, even if it's pretty modest.
You should avoid red light therapy if you have light sensitivity issues with your eyes or your skin. It's a very expensive treatment. For things like joint pain, mental health, and anti-aging, the science isn't there yet.
All right, let's go to the scorecard. For red light therapy, I have to say that the common sense test does work for certain indications. It does have a mechanism of action that's well described, and for tissues that can be impacted, whether it's the retina or the skin, it makes sense. There's a lot of different indications out there where the evidence is not there, but clearly for the ones that have FDA approval and some of the more superficial skin-related stuff, I think that there's some interesting indicative evidence that maybe it's okay. Finally, would I do it? No, it's expensive. It's not quite there yet, unless I had one of these clinical issues like the macular degeneration or the oral mucositis. I probably wouldn't do it.
For me, the common sense test, it doesn't pass this because, again, going back to the penetration, it only goes a few millimeters below the skin, and it's being claimed that it's being used for joints, it's being used for muscles. So on a common sense level, for a lot of the claims, doesn't make sense to me. Again, going back to some of those smaller indications, it's FDA approved. It makes sense in that world. As far as solid evidence, the studies were extremely small. They were in junk journals. It wasn't convincing in terms of the results on these. Would I do it? I'd just walk outside, basically. You'll get all the same benefits, and you'd avoid kind of a wasted, expensive treatment.
As always, this show is for entertainment purposes only. If you're making any decisions about your health, it needs to be through your own research and in consultation with your primary care provider. And if you like this video, please like, subscribe, and share it with all your friends.